Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Moles. Introduction. Moles are common growths on the skin. Most people have between 10 and 40 moles. Most moles are harmless, but about 1 out of every 10 people has at least one unusual mole that looks different from an ordinary mole. These moles may be more likely to develop into melanoma, a type of skin cancer. This program explains moles. It discusses the anatomy of the skin as well as common characteristics of moles. The program also covers when someone should seek medical advice for an unusual mole. The skin and the sun. Melanocytes are pigment cells in the skin. They produce melanin, the pigment that gives skin its natural color. Melanin also contributes to hair and eye color. When skin is exposed to the sun, melanocytes produce more pigment. This causes the skin to tan or darken. Melanin makes the skin darker to protect it from the sun. Without enough melanin, the skin cannot protect itself, resulting in sunburn. Our skin color is determined by how much melanin our melanocytes produce. People with darker skin have cells that produce a lot of melanin. People with lighter skin have cells that produce less melanin. Normally, melanocytes are distributed evenly throughout your skin. Moles happen when melanocytes grow in clusters or clumps. This is why moles are usually a different color than a person's skin tone. Moles. A person may develop new moles from time to time, usually until about age 40. In older people, they tend to fade away. It is common for moles to be brown, but they could be many different colors. They also come in different shapes and sizes. Moles can be black, blue, pink, red, tan. Moles can vary in shape, but they are usually oval or round. Moles can be flat or raised. The surface of a mole can be smooth or wrinkled. Sometimes a mole may start out flat and brown and later become slightly raised and lighter in color. Some moles may become raised enough that they form a small stalk, which eventually may wear away. Some moles disappear on their own. Moles often develop in children and teens, but they can continue to appear until midlife. There are certain times in your life when moles are more likely to change. For example, they are likely to grow and darken during adolescence or while a woman is pregnant. Moles can be as small as a pinhead or large enough to cover an entire limb. Generally, moles are less than 1/4 inch long, which is smaller than the diameter of a pencil eraser. Any body part, including your scalp and under your nails, can have moles.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
When to contact your healthcare provider. Most moles are harmless, but in rare cases, moles may become cancerous. An early melanoma, a type of skin cancer, often has one or more of the following features. Contact your healthcare provider if you notice any of the following A, B, C, D, E's. A. Asymmetry. One half of the mole doesn't match the other. B. Border. The border is irregular. It may be blurred, notched, or ragged. C. Color. The color is uneven. Different shades of black, brown, tan, white, pink, red, blue, or gray may be seen. D. Diameter. The mole may be getting bigger. Most melanomas are at least the width of a pencil eraser. E. Evolving. The mole has changed in color, size, or shape in the previous weeks or months. You should have a healthcare professional check your moles if they become painful, bleed or have liquid on them, itch or burn.
Monitoring moles and other pigmented skin patches is an important step in detecting skin cancer, especially malignant melanoma. But not all melanomas develop from pre-existing moles. Some moles may begin as a new growth on the skin. Some types of moles put you at greater risk for skin cancer. Moles at greater risk of becoming cancerous include atypical moles, also known as dysplastic nevi, large moles present at birth, numerous moles.
About 1 out of every 10 people has at least one unusual or atypical mole. An atypical mole looks different from an ordinary mole. They are called dysplastic nevi. Dysplastic nevi may be more likely than ordinary moles to develop into melanoma.
Dysplastic nevi are moles that are larger than the diameter of a pencil eraser and irregular in shape. These moles tend to be inherited, meaning they are caused by genes passed from parents to children.
Dysplastic nevi are sometimes described as looking like fried eggs. This is because they usually have dark and raised centers and lighter, uneven borders.
Large moles that are present at birth are called congenital nevi. These moles may increase your risk of malignant melanoma, a deadly form of skin cancer.
Having a large number of moles puts you at greater risk of getting skin cancer. If you have 20 or more moles, you also have a greater risk of developing melanoma.
Diagnosis. Your healthcare provider will perform a physical exam. He or she will ask you questions about your personal and family medical history.
Be ready to answer the following questions. When did you see the mole for the first time? Is it new, or has it always been there? Has its size, shape, or color changed at all? Have you had any moles removed? If you have, were they cancerous or atypical? Have any family members ever had atypical moles or melanoma? You may choose to have a skin examination a regular part of your preventive medical care. Your healthcare provider will examine your entire face and body, including your scalp, your palms, the soles of your feet, the skin between your buttocks. If your healthcare provider thinks that a mole may be cancerous, he or she may take a sample of the mole. It will be submitted for microscopic examination. This is known as a biopsy. A biopsy can tell whether or not the mole is cancerous.
Treatment. Treatment of most moles usually is not necessary, but if a mole is cancerous, the entire mole and some tissue around it may need to be removed surgically. Surgical mole removal is often performed in the office of your healthcare provider or a dermatologist. The procedure will take only a short time. Mole removal may be done through surgical excision, surgical shave. During surgical excision, your healthcare provider cuts out the mole and a surrounding area of healthy skin. He or she will use a scalpel or a sharp punch device. Sutures are used to close the skin. During a surgical shave, your healthcare provider will numb the area around a mole. He or she will use a small blade to cut around and beneath the mole. This technique is often used for smaller moles. It does not require sutures. If a mole that has been removed grows back, see your healthcare provider right away.
If you have a mole in your beard, you may want to have it removed by your healthcare provider. Shaving over it repeatedly may cause irritation. You may also want to have moles removed from other parts of your body that are vulnerable to trauma and friction.
Anytime you cut or irritate a mole, keep the area clean. See your healthcare provider if the mole does not heal.
You can cover up a mole with makeup if you don't like the way it looks. You can also trim or pluck hairs growing out of the mole. A healthcare provider can remove the hair and mole if you prefer. Preventing skin cancer. The best way to catch potential problems at an early stage is to know where your moles are and what they look and feel like so you can spot changes. Examine your skin carefully on a regular basis. You should check your skin at least once a month, especially if you have a family history of melanoma. Remember to check areas that are not exposed to sunlight, including your armpits, feet, including the soles, toenails, and between the toes, genital area, palms, fingernails, scalp. If you are a woman, check the skin underneath your breasts. In addition to regularly checking your moles, protect your skin by avoiding exposure to the sun, using sunscreen. Put more sunscreen on every 2 hours when you are outdoors. Wear long sleeves, a hat, sunglasses, and other protective clothing while outdoors. You can even find clothing treated to block UV rays.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Moles are common growths on the skin. Most people have between 10 and 40 moles. A person may develop new moles from time to time, usually until about age 40. In older people, they tend to fade away. It is common for moles to be brown, but they could be many different colors. They also come in different shapes and sizes. Most moles are harmless, but in rare cases, moles may become cancerous. You should have a healthcare professional check your moles if they become painful, bleed or ooze, itch or burn. An early melanoma, a type of skin cancer, often has one or more of the following features. See your healthcare provider about any of the following ABCDEs: asymmetry, border irregularity, color, diameter, and evolving appearance. Treatment of most moles usually is not necessary, but if a mole is cancerous, the entire mole and some tissue around it may need to be removed surgically. The best way to catch potential problems at an early stage is to know where your moles are and what they look and feel like so you can spot changes. Examine your skin carefully on a regular basis. You should check your skin at least once a month, especially if you have a family history of melanoma. In addition to regularly checking your moles, protect your skin by avoiding exposure to the sun, using sunscreen. Put more sunscreen on every 2 hours when you are outdoors. Wear long sleeves, a hat, sunglasses, and other protective clothing while outdoors. You can even find clothing treated to block UV rays. Thank you for using Explain.